Hi, my name is Dr. Julia Ward. I practice out of Dermatouch RN, which is located in Houston, Texas. I practice anti-aging, functional, and aesthetic medicine. About a year or so ago, I started looking into, maybe I need some bioidentical hormones for myself. So I went to my GYN practice, which is a fairly large practice, and was kind of just brushed off. Like they said, oh, you really don't want to do that. You're messing with hormones and I wasn't having overwhelming symptoms, but I thought, I've heard enough about bioidenticals. I think I really would like to explore getting on some. So in the process of learning about bioidentical hormones, I discovered A4M, and that's how I kind of stumbled into this whole functional medicine type approach of practicing medicine. So I can take a much more holistic approach to seeing what's wrong with a patient and addressing their needs, their concerns. So before, when I would see patients, especially in the emergency room, it was always, what's the problem? Here's the drug. Now it's, what is their lifestyle? What's their nutrition? What's their exercise? And then looking at their genomics too. That's also been a real eye-opener. For example, with myself, and I looked at the MTHFR gene, and turns out I've got 2 mutations on that gene, which makes it harder for me to process toxins and process things like, estrogen metabolites. So I know now that I'm going to have to take things that's going to support my phase 2 metabolism, and if I hadn't have known that, then I might have had a problem with estrogen metabolites, toxic buildup essentially. So it's really been a completely new approach. As a functional medicine doctor, I perform tests that aren't standard with other practices. One of my favorite tests is the micronutrient test. Besides testing all these essential micronutrients, some key fatty acids, and some different enzymes. It also does the MTHFR test, which is the genomic test to see how well you process toxins out of your body. So I think that's incredibly helpful when you're trying to talk with patients about what supplements they need and why they need them. So that's one of the tests that I really like doing. The other one is, of course, hormone balance tests. I recommend bioidentical hormone replacement to almost anyone who is over a certain age, and everyone is going to hit that perimenopausal age differently depending on genetics. But there are a lot of reasons besides just relief of symptoms that one would want to be on bioidentical hormone replacement. Our clinic is also a medical spa, so one of everyone's main concerns is skin care, skin vitality, and they don't realize that if your hormones aren't in balance, your skin's not going to look young. You're going to look very old if your hormones aren't in balance. And you can't just replace one hormone without looking at the others, because all the hormones are in symphony together. If one is down, it's going to affect the others. So you really have to look at the whole picture. And this goes for men too. The other reason to take bioidentical hormones is that there have been many studies to show that it prevents dementia. It can be cardioprotective and protective as far as bone mineral density. The med spa, Dermatouch RN, we do, of course, all the injectable treatments like Botox, Dysport, and all the fillers. In addition to that, we do a lot of laser skin rejuvenation. There's a lot of skin resurfacing, fractional lasers, some chemical peels, and then we have the Ultherapy machine, which is the deep ultrasound. It delivers deep heat to the tissues, which stimulates the collagen buildup in your own system wherever you put it, and it gives a nice tightening and a lift. We also have an amazing tattoo removal laser and hair removal laser as well. If you'd like to learn more about the services that we offer, please go to our website, dermatouchrn.com.